If your period leaves you curled up on the floor in pain, missing school or work, or constantly being told it's just part of being a woman, then you need to hear this. What you've been told might not be the whole story, and it might even be dangerously wrong. Hi, I'm Dr. Mickey from the Health and Wellness team at Ubie Health. As the AI face of Ubie's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're talking about endometriosis, a condition that affects about 1 in 10 women and countless others assigned female at birth. Despite how common it is, it takes an average of 8 years for someone to be diagnosed. 8 years. That delay can mean years of pain, misdiagnosis, and feeling like your symptoms are just being brushed off. Endometriosis is a chronic inflammatory condition where tissues similar, but not identical, to the lining of the uterus grows in places it shouldn't. Think outside the womb. We're talking ovaries, fallopian tubes, bladder, and even the lungs and brain in some rare cases. These cells respond to your menstrual cycle the same way as uterine lining, building up, breaking down, and bleeding. But unlike your period, that blood has nowhere to go, causing pain, scarring, and ongoing inflammation. One of my patients, Emma, first noticed something was off at 13. Excruciating cramps, nausea, leg pain, and fatigue that lasted weeks, not days. Doctors told her it was normal and handed her a birth control prescription. She wasn't diagnosed until her 30s, after years of feeling dismissed. Sadly, her story is far too common. So, what are the signs you should watch for? Severe period pain that isn't relieved by over-the-counter meds is often the first red flag. Others include heavy bleeding, pain during bowel movements or urination, painful sex, chronic pelvic or lower back pain, and infertility. Even fatigue and bloating, yes, what some call endobelly, can be signs that something deeper is going on. If this sounds like you, here are some doctor-approved steps you can take. First, track your symptoms. Note when the pain flares up, how long it lasts, and any triggers. This gives your provider crucial information. Next, try some home remedies that can help reduce inflammation and soothe symptoms, though they're not a cure. Anti-inflammatory diets that limit red meat, dairy, and processed foods can help some people. Ginger and turmeric may ease cramping and inflammation, while heat pads and TENS units offer pain relief. And yes, exercise and mindfulness practices can reduce stress, which is known to worsen symptoms, but don't let anyone tell you to just move more if you're in actual pain. If symptoms persist, seek out a specialist, someone with experience in diagnosing and managing endometriosis. Excision surgery is currently the gold standard treatment, often misunderstood or mistaken for just another laparoscopy. Hormonal treatments like birth control pills, IUDs, or GnRH agonists can help manage symptoms for some, but they don't stop progression in everyone. And unfortunately, there's still no cure. Hysterectomy is not always effective, especially since endometriosis can exist outside the uterus. Living with an invisible illness like endo can be physically and emotionally draining. It affects your career, your relationships, your plans for the future. But you're not alone, and you deserve better than 8 years of being told it's all in your head. Worried about your own health? Start by checking in with a Ubie Symptom Checker at ubiehealth.com. It's medical grade. Doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And don't forget to like and follow for more doctor-approved info you can trust from all of us here at Ubie Health.